Well, hello everyone, and welcome to today's webinar. My name is Yeshua, and I'm the Outreach and Social Media Coordinator for the Canadian Cancer Survivor Network. On behalf of CCSN, I'd just like to thank you for attending today's webinar. Cancer Can't Wait Virtual Action Week number 2. This time we'll be focusing on Western Canada. This is the second in a 3-part series we'll be doing, where we'll be talking to a panel of advocates that have joined us in our meetings with elected officials across the country to share their stories and experiences with cancer and the healthcare system throughout the COVID-19 pandemic. If you're new to one of our webinars, let me just take a moment to give you a brief overview of our organization. The Canadian Cancer Survivor Network, or CCSN, is an organization working with cancer patients and survivors to learn about the complexities of our healthcare system, connect with others to plan action, and act on those plans to promote better care and healthier survivorship. If you'd like more information or to learn more about CCSN, please visit our website at www.survivornet.ca. You'll find plenty of information there on us, as well as news, events, and other resources that we think you might find helpful. I have 2 quick announcements before we get started. And the first is that this webinar is being recorded. It will be available tomorrow on YouTube. The video link will be sent to the email you provided when you registered. So you can share this resource with others, or you can go back and watch it again if you like. At the end of the presentation, we will have a short Q&A. However, don't feel the need to wait until the end to ask your questions. You can use the question function in your panel. Please feel free to type questions into the window at the bottom of your screen throughout the presentation, so we can have them queued up for the Q&A session at the end. Now, CCSN is pleased to welcome our panel of advocates for today's webinar. I'll give each a brief introduction. Laverne Woke is our first advocate. She is a lung cancer advocate based in Edmonton, Alberta. Dave Nitchie is also a lung cancer advocate based in Calgary, Alberta. And facilitating today's webinar, we have CCSN's own Public Affairs and Communications Specialist, David Klug. So with that said, I will turn things over to David.
Thanks very much, Yeshua. My name is David Klug, and as mentioned, I'm a public affairs consultant with the CCSN. Thanks, everybody, for joining us. We really appreciate your participation and your interest. We'd very much like to thank Laverne and Dave for joining us as panelists today. They've joined us in a number of meetings with elected officials throughout Western Canada over the past couple of months, and so their insights for our will be insightful, and we're very thankful for them agreeing to participate on the panel following the presentation. So as mentioned, I'll just give you a quick overview of what our plan is today, how this will roll out. We'll have a short presentation here. I'll try to make it short because people want to hear more from the panelists, I would think. But we'll go through the results of our 3rd COVID-19 cancer care survey and the findings, and we'll focus on the Western Canadian data that's come from those. And then we'll move and discuss a little bit about our CCSN virtual action weeks. And we do have some clips from some of those meetings that we had with elected officials in various provinces. With 1,638 respondents, and specific to our presentation today was our 3rd survey of about 1,502 respondents conducted in June and July of this year. Again, that seems to be the timing when restrictions were coming off of the 3rd wave of COVID-19. So some of the key findings that we've identified for patients really across Canada is that patients do continue to experience delays in accessing appointments and treatment, and that cancer care disruptions continue to have a significant impact on patients and their families, particularly on their mental and emotional health. And patients are reporting, which is a good news. Patients did report an increase of in-person interactions, but virtual consultations did continue and continue to be used by a majority of the respondents in our survey. And fourth, the majority of patients continue to report being generally satisfied with the quality of cancer care received during the pandemic. And fifth, and this is highly pertinent to the time at which the survey was conducted at the beginning of the summer, was that cancer patients have a relatively high vaccination rate compared to the general population in Canada, and that's vaccination against COVID-19, although there do continue to be some barriers to access for some patients. For patients who are still incurring involuntary care disruptions, you'll see up here there are some numbers by province. Alberta and British Columbia seem to be relatively similar in terms of the numbers, with BC having 22% of patients having a healthcare service postponed or rescheduled involuntarily, 23% of patients in Alberta. Saskatchewan and Manitoba's numbers tick up a little bit higher, with 27% of patients in Saskatchewan having involuntarily had a healthcare service canceled, postponed, or rescheduled, and 26% of the patients in Manitoba. Now, importantly, it's, when we're talking about a time to reschedule an appointment, this is key. And what really stands out on this slide here is that the timing from the difference in timing to have an appointment that has been involuntarily rescheduled, between the difference between waves 2 and 3 of the pandemic remained relatively steady for BC, Saskatchewan, and Manitoba, anywhere from just over 10 days to approximately 20 days, just given the scale of this slide. In Alberta, that delay has come down to roughly the same as the other 3 Western provinces, but you'll notice that at the beginning of the second wave, the delay in rescheduling appointments in Alberta was up close to 50 days, which is a significant time frame, particularly when you're talking potential diagnosis and time-sensitive treatments. Now, the timeline to reschedule a disrupted procedure or surgery have all increased. Now, we talked about Alberta, and if you go to the past slide where the number of days it took to reschedule an appointment dropped significantly, it has stayed relatively steady between waves 2 and 3, roughly sitting at 70 to 75 days, a little bit higher at the peak of wave 3. The timelines for British Columbia and Manitoba increased significantly, from anywhere from about 25 days to about 40 days, well up into the 60-day range. So we're talking 2 months. We do not have data for the second wave, the difference in Saskatchewan, and you'll see that in wave 3, the delay to reschedule a surgery or procedure was significantly lower than the other 3 provinces, at approximately 25 to 30 days. Shows is that the level of anxiety amongst patients and caregivers really did peak along with the peaks of the various waves of the pandemic. So the first, second, third, we do not have data for the fourth, as that sort of happened and hopefully behind us this fall. During the first wave, anxiety was a little bit over 30%. Again, the outlier here remains Saskatchewan, where levels of anxiety amongst patients was significantly lower than in the other provinces. It did sort of match with Alberta when restrictions began to relax after the second wave of the pandemic, and moved up again at the height of the third wave, and then again dropped down, as you would expect, as restrictions began to relax at the tail end of the third wave. Of notable exception here is Manitoba, where the level of anxiety did not decrease. The trend is going down in the same direction, but did not drop off as precipitously as it did in the other provinces. There could be a number of reasons for that, whether restrictions came off at the same time, whether the level of restrictions were similar as in other provinces or what have you. But this is, again, what patients are reporting to us. So on this next slide, we're talking about patient interaction, in-person interaction with healthcare providers. And numbers are relatively high, but there is a significant range from 70% to 89%. In BC, 70% of cancer patients reported an in-person interaction with a healthcare provider. So whether that be a doctor or a therapist, a treatment provider, nursing of various types. The number is significantly higher at 82% in Alberta, 75% in Saskatchewan, but it did reach a high of 89% in Manitoba. So the vast majority of patients overall were still able to have in-person interactions with healthcare providers despite pandemic restrictions and public health measures that were in place. This slide here is the patient satisfaction with the overall quality of care that they felt they had received during COVID-19. And for the most part, the provinces are relatively similar. Between 54 and 80%, there is an outlier there. So fewer patients in Manitoba reported being very satisfied with the quality of care that they had received. But the level of satisfaction at somewhat satisfied is significantly higher. So when you take the combined somewhat satisfied and very satisfied categories, the numbers are relatively similar across the provinces, with, again, the exception of Saskatchewan, where 80% of cancer patients reported being very satisfied with the quality and level of care that they received during the pandemic. And our following slide here is patient COVID-19 vaccination rates. And again, I'll remind people that this survey was conducted in June and July of this year. So these numbers will have changed since then. What you'll see is that BC is notably higher at 94%. But if you take a look at the percentage of people with 1 versus 2 doses of a COVID-19 vaccine, British Columbia and Manitoba were significantly lower in terms of second dose administration, whereas Alberta and Saskatchewan were much higher at 75% and 74% respectively. I know in Alberta, once vaccines became more widely available, the government did place a higher emphasis on reaching cancer patients with vaccination for COVID-19 where possible. Don't have anything other than anecdotal evidence to support.
I just want to step in here. I know that David is doing a great job of presenting this information. Unfortunately, we are all having technical issues.
Thoughts on that. That would be interesting to know. Numbers are for vaccination. The Manitoba patients report similar. It was 7%. That runs. They're both sitting around a little bit. The Ontario and Saskatchewan. Caution. I've lost you there. Can people still hear me?
We can. I can hear you. There might be a slight delay now.
Okay. I'll move on to the next slide. If you need me to do anything, let me know, Yeshua. So this next part of the discussion, we'll be talking about the virtual action weeks that we hosted and engaged with elected officials in the Western provinces, starting in September and October of this year, and just sort of concluding now with some one-off meetings. And I know that there are still some meetings happening in Ontario and Eastern Canada. And what these virtual action weeks did was really help us connect with decision makers, pardon me. So elected officials, so MLAs primarily in the 4 provinces, as well as some non-elected officials, some one-off meetings there. And the meetings focused very much on COVID-19 care and treatment, and the results of the survey that we've just gone through that I've just shared with you in the previous slides on the presentation. And these meetings help us amplify our message and build relationships with the key decision makers in governments. We met virtually with elected officials, and as I mentioned, with other decision makers within the provincial cancer systems and healthcare systems. This slide provides a highlight of some of the MLAs that we met with across the 4 prairie provinces. In Manitoba, it was harder to meet with government MLAs, as there was a leadership race that had been called right at that time. We're still trying to reconnect with the government MLAs on that side, but we did meet with a minister, and they indicated that they'd be very interested in having us pursue this again with them in the new year, when there is some time and people have moved into their new roles under the new premier. So this slide here is actually a video, and I'll just play it for you. It's some highlights from some of our meetings with MLAs and officials in the Western provinces, and I'll come back to you once this has played.
No, not really any questions. I mean, it's great to see the data. And one thing I would ask, is it possible to get a copy of that survey or of the
Absolutely.
presentation? That'd be wonderful, because that would be very helpful for us in trying to highlight the issue and talk about this. So I'm happy to I will bring this back to my health team and have a conversation about, whether we can find some way to speak with the media, hold a press, or do something, because I think it is very important that we continue to bring this forward in front of the Alberta public. But yeah, this matches pretty much what I have been hearing. As you said, Tim, with the stories in the media, certainly I've been talking to a number of folks throughout the system, nurses, physicians, surgeons, folks at every level sort of the healthcare system, and dealing specifically with cancer surgeries and treatments. So yeah, I'm kind of knew what the impacts were, know that they are getting worse now, and I can only imagine where they're going to be by the time we see the end of this.
We have a problem in Manitoba at the moment. It's actually a big problem that the government is not accurately reporting wait times. And it may be that because they report wait times from when it's scheduled to when the operation or procedure is performed, like hip and knee surgery or eye surgery, rather than from when the initial decision for surgery was made in the doctor's office, or and so that I'm told, well, we've got reported levels of waits for cataract surgery 16, 17 weeks. But the actual reported wait is, I think it's 13 and a half months. So it's like 50 plus weeks. And, we've been trying to raise this, but if the government is giving off what's essentially very misleading information, then this is not helpful at all.
And the last point I'll make with that is, I don't know if you folks have any meetings scheduled with the Minister of Health or folks here in Manitoba on the government side, but it would be worth really pushing them. This is me lobbying you now, but it would be worth pushing them to make sure that some of the changes that we've seen happen in terms of access to cancer care services during this pandemic aren't permanent changes. So, folks, like I said, having to leave the city, go out to the Interlake to get access to certain tests or procedures, or vice versa. We're really hopeful that once we get through this pandemic, that's not going to be a permanent sort of solution, that they'll revert back to what was in place before, and also enhance those services as well.
Yeah, well, for sure. In Alberta, we're just in this very chaotic time. I think the UCP government has decided to, create difficulties with healthcare workers. And unfortunately, Dave, the story you say about your oncologist leaving our province is not uncommon. There's lots of docs that are mad as hell, and rightly so. And I mean, just recently, Minister Taves, is negotiating with the nurses and saying that they need to get $4 less an hour. So, in the middle of a global pandemic, we're expecting healthcare workers to, shoulder all the responsibility, and there's been a huge demand on them. So it's not very respectful, and people aren't happy. And of course, another health huge issue right now is the opiate crisis, where we have 4 Albertans dying a day, so certainly there's, cancer, but I mean, we have this extremely toxic drug supply, and I'm the critic for addictions and mental health. So obviously, more people are dying from this than from COVID. So, but it doesn't seem to be, getting to the top of the priority agenda.
Okay, so with that, I think we'll move to the advocate panel, and with Laverne and Dave. And might be on a little bit earlier than we thought. Just given the challenges with the video, the audio coming through on the video. So for everybody participating on the line, as I mentioned earlier at the beginning, that Dave and Laverne have graciously agreed to join us as panelists here. They're both patient advocates, and they have joined us in a number of meetings with elected officials during our virtual action weeks on the Cancer Can't Wait initiative. So I wanted to start off just because Laverne and Dave, this is the first time that we've met today. We've had a few email exchanges, but was this virtual action week series, was this the first time that you participated in an action week with us, and what really spurred you on to agreeing to participate and really sort of help us with the CCSN with our advocacy work with elected officials?
Go ahead, Laverne.
You want me to start? I think for me, what stands out is my own the difficulty I had since COVID started back in 2020 in March. I'd just been diagnosed in 2018, so I was still freshly diagnosed and still tied in very closely. I'm still in active treatment at the Cross Cancer in Edmonton, but as soon as COVID hit, I did notice that though I was able to still go in for my 3-month CT scans, I never did see my oncologist again, and I still haven't to this day. It's always just been phone calls that he is connected with me, and we've discussed the CT scans and any other concerns fairly quickly over a phone call. So I find that a little disconcerting, because it means that I don't have that same connection that I had originally. I was also, excuse me, typically when I would have an appointment at the Cross, I would go in and have my blood work done. I would meet with my oncologist. Everything would happen that same day. Well, with COVID hitting, I had to then take my blood work and have it done off-site, which I found it was upsetting to me, because of course at that time there were no vaccines, and being a lung cancer patient with stage 4 lung cancer, I was very wary of going out into the public. I was totally isolated at home. I did not want to be in the public. I did not want to see people or become engaged with people at all. So the whole idea of going to off-site to have blood work I was scared. I was concerned about that. And though they worked really hard to try to keep me isolated from other people while I was there, it was still a concern for me. So I think having that in my experience made me want to join this panel and other panels to share some of those experiences. And I'm sure, Dave, you have several other experiences as well.
Yeah. My experiences were pretty similar to yours. I always did go off site for blood work. I'm kind of envious of you in the fact that you can get that done right there. But yeah, my experiences were very similar in the fact that I was diagnosed in 2019. So yeah, right. You know, then the pandemic hits, and all of a sudden you can't meet with your doctor. You can't do the face-to-face meetings, which is very important for me. And for many patients, it's much more comforting to be that face-to-face person, meet them, and have that interaction. With COVID, yeah, I was in the same boat as yourself in the fact that you don't want to go out. You're always nervous. You're always looking around to see what's going on. I did have to cancel a few appointments just for my own anxiety levels. They were sending me to a hospital that had a recent outbreak, and I didn't want to put myself in that situation, so that was my own choice. For myself, the CT scans and MRIs, they continued, but the AHS was super good about having only one person in the room at the time. It was very good in that sense. But yes, I totally understand where you're coming from, Laverne. It's definitely a scary situation to be put in, and I think that's the reason that I joined this as well. Is that we need to let the politicians know, the MLAs, everyone that's involved in it, that it's not just going to the hospital for a CT scan. There's a lot of anxiety behind it initially, even without COVID going on, and people need to know that. David there?
I don't know if David is, it's showing he is here with us, but. Having met with several MPPs from different parties, did you feel like or the however many meetings you were able to attend, did you feel like your concerns have been heard or have been addressed at any point, or any of the letters you've sent to MLAs or members of parliament?
I was actually very impressed. Yeah. Go ahead, Laverne. Sorry.
No, you go ahead, Dave. I can jump in after.
No, I was very impressed with the meetings that I did have that I attended. Everything that was said was very well received. I did find that if the MLA had a personal connection, who doesn't have a personal connection with cancer, but I found that there were a few MLAs that actually were diagnosed with cancer, and that was a big stepping block for us to get reaction from them and to get more advocacy out of it. I was impressed with a few that actually did email me back or write me back. So I think it was very well received.
Well, that's good to hear. I totally agree with you in that the personal stories, the personal connections make a huge difference. MLAs who don't have those personal connections have more difficulty understanding our insecurities or our anxiety when you're dealing with cancer during COVID. I did send out a few letters to different MLAs in Alberta and have received replies. They were always very well received. Unfortunately, my requests at that time weren't always able to be answered by the MLAs, but I did get positive responses from them. And I know one of our meetings, it wasn't an MLA, but it was an assistant to an MLA. I believe he was an issues manager, and we were talking about different things that would help to alleviate anxiety in cancer patients. And one of the things that came to mind with me, especially in the early COVID days, was I was always upset with hearing how many COVID cases were new every day. Every day you would see it on TV. You would see this many hundred COVID cases and that many hundred the next day. And I was really concerned. Then once the vaccinations came, I felt that should change, because we should be hearing, yes, there are cases, new cases of COVID, but I wanted to know how many were happening with unvaccinated in the unvaccinated population and how many were in the vaccinated population. And so when I mentioned this to this issues manager, I don't know if it was by coincidence or not, but the very next day, CTV was then starting to put up on their screens that there were, X number of new cases and this many people were vaccinated and this many people were unvaccinated. And I found it gave me, it was sort of a security in that I was seeing that there were more and more vaccinated people, and that it was those that were unvaccinated that were coming to the surface of the active cases. So that certainly alleviated a lot of my anxiety. And as I say, I have no idea if it was just coincidence, but it worked out well. So I was happy.
Agree with you on that one, Laverne, for sure. That was a big concern for me too. You see all these numbers popping up on the daily news, and yeah, it was comforting to find that the unvaccinated population were the people that were hospitalized, or that those numbers were comforting in the fact that the numbers were going down with some vaccination.
For sure. Of the meetings you have attended, or of the instances where you've interacted with MLAs or MPs, perhaps even, is there one particular interaction that stood out to you? Obviously, this one where Laverne just mentioned, requesting a very specific thing, and whether by coincidence or not, the next day, sure enough, there it is. But anything else that sticks out to you from your interactions with MLAs or MPs?
I wasn't at the one with David Shepard, but I would have loved to have been, because I think he's great. But the one that stuck out for myself was Lori Sigurdsson. She was again at the start of the meeting kind of very political, but then I realized that, or she shared with us that she had battled cancer as well, and it really opened the door for me. And we had a great conversation. It was very, very positive.
Yeah, and I think that's important, as we mentioned earlier, is that if they have a personal connection with themselves or a parent or a loved one, it makes such a difference. And I think they become much more involved, and they become a stakeholder in dealing with cancer during COVID. And that's just so important, because you can't get that personal response otherwise.
For sure. You can see David's trying to share something, but we can't hear you.
I was just asking to see if you could hear me again. We've tried reconnecting. So.
We did hear you that time.
Okay.
Yeah, that's good.
Well, apologies again for I've been blocked out for the past 5 minutes or so. I'm sorry about that. So thanks to Yeshua for stick handling that for us in the meantime. I'm not sure which questions you were able to get through, but do you have any words of encouragement for other people who might be interested in becoming advocates and somehow getting involved in advocating on behalf of cancer patients and people facing treatments, diagnoses?
Go ahead,
Actually,
Dave, you can take.
Well, everybody wait for each other. Yeah, actually, funny you mentioned that, David, because last week I had coffee with a friend of mine that is stage 4 lung cancer as well, the same as myself. And she was really wondering, she's been very private about it and hasn't shared with a lot of people about it. And she sees what I'm doing and what other people are doing. And she asked me point blank, she says, should I start advocating? Should I come out and tell people? And I said, absolutely. I said, there's great value in it, not only for yourself, but for other people as well. And she did that, and she's joined the White Ribbon Project, this one right there. And she's just going for it, and it's great from my perspective in the fact that I made a difference for her, and she's just going to go crazy with it too. So yeah, I encourage people to get into the advocacy part of things, because it's makes a big difference, makes a huge difference. Even if you're, you could work at it for a year and not see any results, and all of a sudden you go have coffee with somebody and they're just, wow, you made me think about things, and now I'm going to come out and help you guys out. So yeah, I'm a part of, I would say, probably 4 or 5 different advocacy groups, and there's so much crossover too. You'll be talking to somebody from, say, Lung Cancer Canada or the White Ribbon Project, and you'll mention a name from the Man Up to Cancer group, and oh, I know them, and it's a big community, and you have tons of support. Everybody's there for the same reason.
Yeah, no, I totally agree. And I received my white ribbon, like yours, in just behind you, from Tim Mons. He presented with mine, and I think that's what gave me the impetus to start advocating. I also had some personal difficulties with cancer treatment at the hospital, and that I needed I need to go down into a new treatment, a new target therapy that's not available. Well, it's available, but not funded. So I've been advocating for that, and I've been getting a lot of help actually from my local MP, who is now trying to, he's been speaking with Pfizer to help me with that medication, which is great. And we're still working hard on that. But absolutely, I think too that the whole mentality of, we've always felt that our doctors and our health professionals, they're there for us. They are on our team, but really they can't do everything. They can't be all encompassing. We have to advocate for ourselves, and that sometimes you need to get out there and you need to do some research. You need to find out what's available, what's happening in different countries around the world, to know exactly what you should be expecting from your own health care workers and your oncologists. I know my form of lung cancer is only found in 3 to 4% of all lung cancer patients. So it's very, very unique, and there aren't very many of us in Canada. So of course there aren't many specialists in this area. So I do need to do some advocating, and I've done a lot of research, and I take that research to my oncologist, and he's actually been very, I wouldn't say excited to get all this information, but certainly he accepts it, and he asks me questions about it, and we have, great discussions on it. And I think that's so important, because I think so often, I'm on the older side of the panel, but I think, in the olden days, you think, well, your healthcare professional knows everything. They are all knowing. They were godlike. But I think you need to get in there. You need to advocate for yourself, because it is your life, and you need to take care of it. So there, I'll stop now.
A quick little story, Laverne, on that with advocating and bringing it to your oncologist. That makes such a difference. My first oncologist that I was set with when I was first diagnosed, he moved away to California, so I got a different oncologist. But he knew that all the advocacy that I was doing through Lung Cancer Canada and all these other programs and organizations. He actually searched me out, and I now have his phone number and email address for him down in California to see what I'm doing up here to help out. And he just wants to keep tabs on that. So it goes far.
That's excellent.
Yep.
Now, again, you may have addressed this while I was sort of in the cloud netherworld, being locked out here, but from your perspective, what are the main messages that that were most well received by the officials that you met with during those meetings with MLAs? What was there anything that was really shocking for them, or eye-opening for them, or that they felt this is something that we can really address here and now?
Nothing really shocking, I don't think, but we're just, I was just trying to get the message across that if you have lungs, you can get lung cancer. The stigma of the smoking part of lung cancer is something that we should really keep pounding on people, that if you have lungs, you can get lung cancer. Like, I never smoked a day in my life, and here I am. So there's still people out there like that. So I think that was my main goal with meeting with them.
Yeah, and I'm in the same boat as well. Never smoked a day in my life. And yes, I have lungs, and yes, I have lung cancer. And I think one of the things that officials were surprised to hear was that so many people during COVID were scared to go out and to get tested, especially with lung cancer. A lot of times you don't even know that you're sick. You don't even know that you have lung cancer. You have a cough or something aches. And so you just kind of put it aside. Now, during COVID, that happened much more often because people were very reticent about going to their doctors or family doctors. Mine wasn't even open. He was closed to phone calls only. We can't really diagnose any kind of cancer over the phone. And I think a lot of the officials were surprised that people were not going to doctors and not going for screenings that were so important, because that's the only way that you're going to find out. And unfortunately, with lung cancer, so many people are diagnosed at stage 4 because they do stay at home. They don't go out to get the early screening, which is now starting to be provided. And it's just so important to encourage people to go to their physicians. And COVID, unfortunately, really curtailed a lot of people from doing that. They were too nervous to go out during COVID, or doctors weren't available. So it certainly, and I think now we're going to see a lot more people starting to come out with more diseases, with more cancer, because now they're actually going to the doctors. They're going for the testing. They're going for CT scans. And I mean, last time I went for my CT scan, the place was packed. I've never seen it like that. You know, and I remember saying to the nurses, like, what is happening? And they said, this is exactly what it's like day after day. And they were starting earlier in the morning and going later in the day because they had so many patients to see. And I think that's just the leftover from the early start of COVID. And now people are actually getting out and going to their doctors. And now all these cancers are being discovered, unfortunately, in later stages. And it's upsetting to see.
That's a really good point, Liver, and that was another point that I was trying to get across with the MLAs, is that what cancer patients were like prior to their diagnosis. You know, not being a smoker, being an active guy, an athlete, a triathlete, runner, that sort of thing, and now how my life has changed now. It's incredible, but yeah, the early detection is a big thing that I tried to get across with the MLAs as well. It's a very good point.
Now I can see there's someone has written in a question here, and you know, I apologize to Yeshua if I'm jumping the gun a little bit on this, but back to Laverne's point on advocacy and a bit of self-advocacy here, in terms of, you know, you mentioned that you were working with your oncologist and your MP in terms of accessing new treatments that may not be covered by provincial health systems. There is a question here from Warren saying he's been fighting prostate cancer since 2012, and he's come to the point that there is no additional treatment available in Alberta, but he feels that there are some additional treatments that might be available in British Columbia. So he's asking, you cannot find another way to access them. Is there a way for an Albertan to access treatments in BC? And I'm not sure that we are really able to answer that here. But in terms of sort of the self-advocacy, any tips for Warren in terms of how he can get that message across to the people who are treating him and who can advocate on his behalf to potentially access alternatives in other places?
Well, I guess it would depend on whether he's looking for an actual is it a trial that's happening in BC? Because I know that there are trials happening across Canada for different kinds of cancers, and you don't have to always be from that province to take part in the trial. So I guess you'd have to find out exactly whether he qualified for that trial, and he should be able to contact them to see if he is, and really his oncologist should be able to give him that kind of information, or whichever center he's at, to see if he to see if it is a trial that would he qualify to go to BC, or would they be able to treat him? I'm not sure where he is. Is he in Alberta?
Take myself off mute. Yeah, it appears that he is in Alberta currently. Yes.
Yes. So yeah, so he should check with his cancer center and with his oncologist, and they should be able to find that information out for him. But you know, so often it's not brought to our attention that there are all alternatives. And I know that there's a trial going on that I could perhaps access. It's in Toronto. So, you know, I would have to contact them to see is it that the kind of thing where I would be able to go there for a short period of time, then come back, or could it happen here as well? I mean, you just need to ask some questions, and sometimes get on the internet and contact the trials directly. There are formats or platforms about clinical trials across Canada that you can access.
Through the drug companies as well, there are clinical trials that go on that you can access as well.
Absolutely.
We do have a few minutes left here, and I don't see, you know, Yeshua, I don't see any other questions in here, but maybe we'll put it out there to the participants that there is a question box on your control panel that you can type questions in, and we'll do our best to answer those. I see that Warren, who we've been talking about here, has just replied saying, my oncologist will not consider clinical trials or other treatments in any other jurisdiction. As such, I have fired him and requested a more realistic oncologist. So,
and you know what?
that falls in line with self-advocating with your own care team.
Yeah, nothing wrong with that, because personalities don't always match up. Absolutely.
Yeah. Nothing wrong with that.
Again, if any of the other participants who are online, if you have any questions, other than why I was frozen for half of the time, for that we'll have to ask Telus. But please go ahead and put them in the question box in the control panel of your GoToWebinar control panel.
I would throw it one more little note here, and I'm sure Dave has come across the same thing regarding MLAs or MPs, and that is talking about funding, and the fact that we definitely need more funding for research, for early detection. I mean, a lot of cancers, but lung cancer has the lowest profile for research and funding, and as Dave mentioned, it's mostly due to the stigma of tobacco. Like Dave, I was super active at the gym 7 days a week. I was, you know, constantly out and about. I never smoked, and I've, you know, a super healthy eater, all of that, doing everything right, and then to get waylaid by this diagnosis of stage 4 cancer was just such a shock. And I think our MLAs, our MPs, they really do need to take a look at the funding that is going into especially lung cancer, because it is the lowest, and yet we have the highest death rate amongst all the different cancers. And it's certainly something that is upsetting, I'm sure, to all of lung cancer patients. But I think that research, the funding is just, it's so important.
Okay.
Dave, do you have any last words
I don't.
to share with us?
Yeah, just to agree with Laverne, the funding is super duper important. I was talking to someone this morning that it's the lung cancer is the #1 cause of death for cancer patients. You know, worldwide, it's incredible, and like Laverne said too, you get diagnosed at stage 4. A lot of people do, and it's just it comes out of the side, and you're totally blindsided by it, and you don't know. You have a sore back, or you have a little bit of a cough, and you just don't get tested, then you go in, and you have stage 4. So it's the funding is very important for that early detection process to be implemented in Canada.
Wow. Well, thank you guys so much for this incredible panel. I feel like we still have, I'm a bit off script here, but we still have one more webinar in the series on self-advocacy, and I would just love to invite you both back to be part of that panel, because what we've heard today is there's nobody who's going to advocate for you better than yourself, and I think you know, if that's not the story we've heard today, I don't know what is, you know. So yeah, just a pre-informal invitation to join us again for our self-advocacy webinar in a couple of weeks, which will be taking place in the new year. Just one final question here that Warren has submitted again, just before we go. And maybe this will be the last thing before our closing, is can you send instructions on how to become an advocate? So any suggestions for anybody out west?
I would just look into the groups that are with your cancer. There's obviously lung cancer, there's prostate cancer, there's all sorts of different ones. I would just get on the web and start looking for that certain type of cancer and go from there. I'll just put another plug in for the Man Up to Cancer group. We have a Facebook page as well. It's for men and their caregivers. There's lots of advocacy people in there as well. So.
Yeah, I agree with Dave. I was never a Facebook user at all and didn't have any support groups at all at the Cross Cancer in Edmonton when I was diagnosed. And I sort of sat in isolation for the first year or two. And then someone mentioned, you know, get onto Facebook. There are groups, there are support groups for you. And that's exactly what I did. And that's what really gave me the knowledge and the background information to then start advocating, self-advocating for myself. I read all kinds of articles. It was, I attended numerous webinars that had world-renowned oncologists from obviously all over the world, if they were world-renowned. And it was just so informative. And I learned so much, and I learned that, yes, I do need to advocate for myself. And now I've got some information that I can put into my back pocket and take to my oncologist with me. And it's, you know, we can all do it. And it's just getting that starting point. So even if you hate Facebook, which I have no idea of what it is, because all I have are my little support groups that I go to. But it's worked well for me. And it's given me just this huge, virtual hug from all these different people that are advocating for themselves, that have all this background, as well as all of the health providers that provide all that information gratis. It's quite amazing.
Yeah. I think if I may, I'll just plug CCSN's website again, survivornet.ca. We've got, like if you're looking for support groups in your area, we've got pages on so many different cancer types, and then resources to go along with them. So whether that be support groups, cancer centers all across Canada, we get emails all the time of people asking questions like, hey, I've got I've kind of run out of options in my area. Can you help me out? And so we start with asking them like, what province are you in? What area of the province? Here are some resources we have that you might be able to look into. So if you're looking for a support group or you're looking for more information on any particular type of cancer that we have information on, survivornet.ca is a great place to start. And that way you'll be able to connect with some of these Facebook groups and find other people who are advocating already that you can, we're just pointing people in the various directions they want to go. So I'll leave that there. But thank you so much for attending our webinar today. And thank you again to our panel of advocates, Laverne Woke and Dave Nitchie, for a great and insightful discussion and all the work you do for the cancer community. Thanks also to our facilitator, David Klug. We hope that these technical issues haven't deterred you from joining us again for another webinar. But yeah, it's been a fantastic hour now, and we look forward to continuing these very important webinar series. So this is, like I said at the beginning, this is a second in a three-part series of webinars that we're doing, and registration information for our third one on self-advocacy will be out soon. So watch your inboxes and social media feeds for that. A quick note about email. If you're not seeing our emails in your inbox, please check your spam or junk mail folders, as we use a third-party email service. So check your junk or spam folders for that, and mark CCSN as a safe sender so that, or add us to your contact list so that you get our emails straight to your inbox. Like I mentioned already, all of our previous webinars are accessible on demand through our website, survivornet.ca/webinars is where you can go for that, as well as all other kinds of cancer resources. And yeah, thank you so much again for attending, everyone. We hope that you enjoy the rest of your day.
Thanks very much, everybody.
Thank you.
Thanks, Aaron. Thanks, Dave. And thanks, Jessica.